Yeah, thank you for kind introduction. I will speed up and try to finish by 11:55. So I'm going to talk about today and tomorrow of NECA, and brief introduction of NECA, and then the future plan of NECA with the two components of my presentation. So this is a very complex system, as Dr. He mentioned about. We have three basic tracks of health technologies, and they have a different path to go through to the decision-making process. And drugs are basically, we can do the research, but it's not really linked to the decision-making process. So the regulatory approval from KFDA goes to HERA for economic review, and then goes to NHIS for price negotiation, and then decided for the National Health Insurance coverage. So medical device similar, but HERA has a bigger role there. And diagnostic method and procedures, our CNHTA division in NECA provide report, HTA report, to the Committee for New Health Technology Assessment, and they decide. So there are some distinction between diagnostics and procedures versus the other health technologies. So this is one slide actually in your booklet. Dr. He originally input, and he has a very nice distinction. But let me just briefly go over there. So KFDA and CNHTA, a lot of times people argue that they are duplicative and they are both looking for safety and effectiveness. But actually, if you look at them very carefully, there are some basic differences. I think the biggest difference is in the reviewing part. KFDA review is done by the administrative staff, and also relied on the application of the industry data. And CNHTA review is done by our HTA expert and HTA team working with a clinical expert. It'll take like 6 months, as Dr. mentioned. It's a much longer process of reviewing and generating HTA report. And that report is used in our Committee for New Health Technology Assessment, some kind of operator process to decide the recommendation. So the review process is the biggest difference, and also the results are slightly different. But also the perspective, I should have to point out that KFDA review is more focused on the medical device itself, the functional part, whether it works, or during the functionality, whether there is any hazard related to it. Versus CNHTA effectiveness is more focused on how does it work in human beings, and especially the patient. That's why there are some big difference. But the most unfortunate thing is in Korean, efficacy and effectiveness both are translated into same Korean word. So that created a lot of problem and all these so-called duplication. So it was our original idea of establishing NECA. Dr. He did a lot of effort to establish this agency, starting from the market access until it goes really diffused into the medical society. That was the kind of original target of NECA. And we have history you can find from our English website or Korean website. So it started from a long way back, but it was established in 2009, December, when I was the university professor in the US, and I heard about its establishment and basically applied in the December 2009 to join NECA. And it was it was 2008 December when I heard about it, and I applied, and I became an employee of NECA from 2009 April. So it was a great experience to start working in the startup agency, but also we had to work really, really hard, much more than research actually. So there are several milestones, and I think one of the biggest impacts to the Korean society was actually we are the first agency to solicit research topics from the general public. Most of the topics are from the academia, but there was a kind of, I think, big try, and nowadays many public organizations follow the public topic solicitations. So this was a pretty big impact. And also we had several milestones in 2010, including the glucosamine project, result released in February, and not that many reports and not that many people concerned. But in same year, October, when Korean media reported the same results from some Swiss university meta-analysis result, that basically was in the broadcasting, and we had a little bit bitter experience, and we had to work harder on dissemination of our research result, or maybe we have to really learn that knowledge mobilization from CAS. Also, there are several other milestones, and starting from the 2009, one thing we really focused on was to learn from the international experts and to learn from the other countries' HTA experiences. So every year we hosted international symposium like this one, and this one is actually a little bit bigger than our usual one, but that was a kind of our big effort and focused on developing our capacity. And throughout those international symposiums, I think we learned a lot. And also, we did a lot of international collaborations, and that became one of the big contributions to nowadays NECA, I believe. In 2012, this is the year actually we started HT Asia Link. Actually, we had talks in earlier year. In 2012, we almost officially started in Bangkok, and we become the secretariat for the HT Asia Link to help for the international collaboration in Asian Pacific. In 2013, last year, we had some changes, including we got the new president, Tae-Hwan Lim, joined us. And more importantly, we had this HTI 10th annual conference hosted in Seoul. And Dr. Tae-Hwan Lim was the ISPC co-chair, and he contributed a lot for the success with the local organizing committee chair, Dr. And this 2013, we also moved to a new place in Chungmuro, a bigger place with a faster elevator. That was the key part for our work efficiency. In our previous building, we spent half of the day waiting in front of the elevator because there was only one. And the legal background of NECA was this law, Health Industry Enhancement Act. They revised this act in 2008 to establish NECA. So as you can see, the goal of NECA was analyzing clinical effects and economic efficiency of drugs, medical devices, and medical technologies, and to provide scientific evidence to the people and ultimately contribute to enhancing the national healthcare quality. In 2013, actually, there are a couple of big important legal changes. The new health technology assessment function, which was transferred from HIRA to NECA in 2010, becomes our legal function. So now in our basic law of this Health Industry Enhancement Act, revised in 2013 version, new health technology assessment become our legal function. And also we got some changes in data access clause. So we had a data access clause to request data to public agencies, but now we modified it, and we have no more broader or more clearer concept of demanding for the research data. So that was the two changes. And as you can see, 2013 October, Dr. Tae-Hwan Lim became new president. So we are under new leadership. And after that, we have these changes in our organizational structure in early this January. So this is our current structure. President, and there are two important committees. So we have a the Committee for Research Planning Management, which is the expert committee overseeing the scientific quality of our research plans, and also decide which research projects to go on. Starting from public solicited research topics, we do the scoping and we develop into project, and those developed projects will be reviewed by Committee for Research Planning Management, CRPM, and also we have our own IRB committee. So until 2012, we did not have public body providing public IRB service to the public generally. So NECA was the kind of pilot public IRB role, and then now it is under the different agency. So IRB was from the start very important role in our research. Also, now we have 4 big divisions. One is Office of Research Planning, which I'm overseeing, and Division of Health Technology Assessment Research, which Dr. An, the chair of this session, is overseeing. And also we have a Division of New Health Technology Assessment. They do support Committee for New Health Technology Assessment. And also we have Office of Management and Support, which Mr. Soni is overseeing, and they provide really good service to us. And Division of Health Technology Assessment, there are 8 teams. So there are HTA team, Healthcare Safety, Comparative Effectiveness Research, Economic Evaluation, and Policy Support, Horizon Scanning, and Clinical Practice Guideline, and also Research Dissemination. So these 8 teams are actually doing the research. In the Division of Health Technology Research, they also have Research Collaboration Team, which support these 8 research teams. Under the Research Planning Office, we have Research Development Team, and also Public Relations, and also International Relations, where Dr. Lee is overseeing. So these are major type of research we do. Topic solicited research. Also we do methodology research. I'm going to show you our manual series in a moment. And also cooperative research. Our English name, NECA, the C stands for collaboration. From the start, we aimed for collaborating with other agencies like National Health Insurance, HERA, or KFDA, or many other ministry, absolutely. New health technology assessment, also we do some more macro level health issues, more policy level, planning research, RAPID, which we modeled from CADIS HTIS, and also extramural project. We sometimes receive projects from the other organizations. So let me skip over this part. New health technology assessment process. Since I do not have time, I'm just going for very briefly. For the 1 year duration period, they started from the receiving application. They check whether that application is a really new health technology. So there are some legal steps we follow. And then once it's decided to be new, then we mobilize the specialized assessment committee composed of our steps on health technology assessment, plus clinical experts on the specific technology, normally 3 or 4. So they work together for the next 6 months period to generate health technology assessment report. And it is reported to Committee for New Health Technology Assessment, and they will decide. So they are basically appraising the reported NHTA report, and they, if decide to recommend or not, that will be under the ministry public notice. So it takes 60 days because of ministry committee to decide public notice happens every month. So if it missed that specific time interval, it may go to the following month. So it can be 60 days. And our all evaluation status are open in our NHTA website, so you can check the name. Unfortunately, right now, we only have the title in English and the contents in Korean. So to get the Korean summary, you have to contact us directly. So Committee for New Health Technology Assessment composed of 20 individuals with various backgrounds. Majority is medical doctors, but also lawyers and consumer representatives included. A subcommittee are specialized on the specific part, and we have a pool of 448 medical doctors throughout the nation. Okay, this is the current statistic from 2007, May 1st, when NHTA started, to last year, December 31st. So they reviewed 1,429 technologies, and basically they decided to review about 670, and there are some reasons for no review, and also when they decided to review 67, only 33 is remaining. International presence of NECA, so we do the international collaboration through HTI Link, which we are the supporting secretarial service, and INATA board, and also we hosted HTI and many other international activities we are engaged in. So these are our method manual. So we have 7 method manuals in Korean, started from our systematic review to Bayesian meta-analysis. And this Bayesian meta-analysis, we found this might be useful for the other international audience, so we translated into English. So now we have 7 Korean manuals plus 1. Plus we got 2 more manuals drafted last year. So this year we published 2 more. So total of 10 manuals on our hand, and 9 Korean and 1 in English. So we will try to translation project probably in the future for the other part. But I guess the Bayesian meta-analysis is a world first, and we hope other people can use it in other than Koreans. So there are some Winbox programs how to do it with all the major issues with Bayesian meta-analysis summarized. So we are also welcoming any comments from our fellow agencies or experts. Also, we joined Euroscan in 2013. So we established NECA H site, horizon scanning unit in NECA, and we will do the full scale from this year. And also, we started this conditional approval process in new health technology assessment, so that there are some promising health technologies, but do not have much evidences. Then basically, we are supporting to develop evidences on those technologies for 3 years. And this is the future of NECA, as our CEO mentioned about our future white paper. So this is the kind of whole life cycle of health technology, starting from R&D to emerging health technology, and some looks promising. We support as the conditional approval track, and also new health technology review. And for the existing health technology, we do our 8 research teams to research on topics. And also later, we may do also optimizing health technology. Once the new better ones coming up, we will deal with optimizing the portfolio of health technology. So these are the life cycle management of health technology we are aiming for the future. Thank you very much.